be taking you guys through the next half an hour regarding emergencies and CPR and first aid. To make it easy for everyone, we have so many people joining in from so many institutions. It will be slightly difficult to ask questions with you face to face in the middle of the class. So please, the chat box is enabled. Put in your questions through there. I'm logged in through two devices. So when I'm taking the class, if there are some valid questions that are coming, I can go to the chat box on another device and I can address your questions. I'll be also asking you some basic questions, some ideas about some emergencies, about what you think is right. Like suppose be it snake bite or fits or seizures, about cardiac arrest. What is your knowledge? Where do you get it from? From probably movies or even Instagram reels sometimes, wherever, whatever you think. And we'll discuss based on that. And I'll try to clear a lot of your doubts. Probably I'll clear some myths. And after this class, you will all know how to deal with all these emergencies. Right. So let's get started. Point number one, after this class, which will last for another 45 minutes to 1 hour, you will all be ready to deal with any emergency that you face, be it cardiac arrest, snake bites, fractures, fall from heights, multiple other situations. So when you know how to deal with these emergencies, one thing you should understand is that the patient who is suffering from this emergency situation is in that situation because of something. For example, somebody with a snake bite, electric shock, fall from height, drowning, they're in a dangerous situation. So after this class, you will know how to deal with that situations, but you have to always take care of your safety first. You should not just jump in to help someone without considering your safety, because if you do that, then you will also become a patient, right? So when I mention about safety, it is safety of yourself first. It is not patient safety first, because as you can see in the image, this is how a real emergency situation will look outside the hospital. A road traffic accident, a major collision, a snake bite, or an electric shock. So personal protection is very, 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 very important. Only when you're sure about your personal protection, you can go ahead and then take care of the patient's protection. Once we are okay with the patient's protection, then you have to take care of the bystander protection as well. When I mention bystander protection, it refers to all the people who are just standing there taking photos, videos. It happens in India, right? Whenever there is an accident, some people try to help, but some people want to take photos and videos. Sadly, you'll have to take care of those people as well. Otherwise, a small, simple accident situation can become a huge accident situation. So, scene safety is most important before you go ahead and help someone. Before I go into this depth class about first aids and emergencies, we have all heard of the terms cardiac arrest and heart attack. Can anyone tell me whether they are same or different? You can use the chat box. Do you think cardiac arrest and heart attack are the same or they're different? Anybody? Excuse me. They're different. Very good. Very good. That is different. Can anyone tell me what is more difficult to treat? What is more dangerous? Whether cardiac arrest is more dangerous or heart attack is more dangerous? Which is more dangerous? Great. Cardiac arrest. Wonderful. We have good answers coming in from everywhere. So, as you all have correctly pointed out, cardiac arrest is more dangerous than a heart attack. So, we have blood circulation in our body. So, the heart also has a blood circulation. So, heart has some arteries that has blood circulation. If there is a blockage in one of the arteries of the heart experiences a heart attack, right? So, when the heart experiences a heart attack, what does the patient experience? What is the most common symptom of a heart attack? Anybody? When the patient is having a heart attack, what do they experience? Wonderful. Chest pain. Chest pain is one of the most common symptoms of the heart attack, right? So when this chest pain is there, suppose the patient is having a heart attack. If this patient is not treated properly, let's say some patient has chest pain, he thinks it is because he ate some oily food yesterday or he's having some gastric. He's an elderly man who's having a heart attack, but he does not go to the hospital, right? So this heart attack progresses, and when it is not treated, it progresses into cardiac arrest. So obviously, by common sense, heart attack is very easy to treat. Cardiac arrest is more difficult to treat. Not just easy and difficult. If you treat all 10 out of 10 heart attack patients properly in the hospital, there is a chance that you can save 10 out of 10 people. So we treat heart attack patients by blood thinners, angiogram, angioplasty. We even do bypass surgery whenever there is required. You would have heard of the simple terms like stenting or blood thinners and all these things. But if cardiac arrest is there, it is more difficult to treat. Not just more difficult, even if you treat all 10 of them properly, the success rate is very low. You cannot save all of them. That is why you have to identify heart attack properly, which would be chest pain, pain in the shoulder, goes to the back, jaw pain, sweating, as wonderfully people are pointing out in the comment section. All of these symptoms can lead to a heart attack. It has to be treated immediately, and most people can be saved. If you don't treat it, it progresses to a cardiac arrest. As you would have seen in this cardiac arrest, the patient becomes unconscious. I am sure if you're all social media users, recently 1 or 2 weeks back, there was a viral video of somebody in a red shirt playing badminton. He just immediately collapsed on the badminton court and he eventually died, right? So, one good thing about social media is people get to know what is happening around the world, and also they can get some information as well. But I would like to warn you, sometimes the information can be wrong. So whatever I tell in this class is medical information that is fact based. So your doubts will be cleared. So when you have someone unconscious, let's say not cardiac arrest, when you have someone unconscious around you, what do you first do? So whenever I ask these questions, please feel free to type in chat box. I have another device. I'm able to see the answers in the chat box. When somebody in your office or in your workplace, somebody in the corridor is just unconscious, what do? Sprinkle water. Wonderful. That is a good thing. First aid. What type of first aid would you like to give when somebody is unconscious? Check pulse is a wonderful answer again. Sprinkling water on the face is a good answer, but trying to feed them water is not a good thing. Okay, because if the patient is unconscious, they will not be able to swallow the water. So should not force water down their throat to drink. That is a bad thing, right? Sprinkle water is a very good thing, and try to wake them up. As you can see in the PowerPoint that is going on in this, that image number one, shake and shout. That means if you shake and shout their name, or if you do not know them, hello sir, hello madam, tapping on their shoulders, they will become conscious if they're just unconscious. Why not start CPR directly? Why can't you start CPR directly? Anybody? I'm getting some wonderful answers in the chat box. It's very lovely to see. If a patient is unconscious in your corridor, in your office, why can't you start CPR? Can be dangerous. Okay, definitely can be dangerous. But why can't you start? Because there are multiple other reasons for unconsciousness, not only cardiac arrest, right? What are the other reasons of cardiac arrest? It may not be needed. Wonderful, wonderful, Ms. Devi. So there are other responses or reasons for cardiac arrest. Sorry, there are other reasons for unconsciousness. What are the other reasons for unconsciousness that you see on a day-to-day basis? Like we see Mr. Ankit is having a lot of water. If he did not have water since morning and he's out in the sun whole day, he will have a sunstroke, which can also cause unconsciousness. Or low BP. Wonderful answer. Low BP, low sugar, giddiness, and even simple things like did not have breakfast, dehydrated. All of these, overtraining, hypertension. Wonderful answers coming through. So all of these things can cause unconsciousness. But are these patients in cardiac arrest? No, they are not in cardiac arrest. They are just in a different reason related unconsciousness state. So that is why you have to first shake and shout. Then in the PPT is an American slide that says 911. What would be the number you call in India to alert the ambulance response? 108. Wonderful, wonderful, Mr. Gurumurthy. So this is what you would do in India. You would call 108 and you'll alert the ambulance. And then you have to check for pulse. As you can see in the picture number three, you have to check for pulse in the neck, not in the hand. I cannot see all of you, but I would like for everyone to touch the center of your neck, like I'm showing now. Once you touch the center of your neck here, it's a hard cartilage, right? It's a hard cartilage. And from there, either left or right, slowly you slide your hand, you will get a depression. See, almost midway between the neck here, you get a depression. That is where you get your pulse, right? So now you're checking for pulse in an unconscious patient. How long will you check for pulse before you decide whether he is having cardiac arrest or not? How long? 60 seconds, Mr. Gurumurthy. It's a long time. That's quite a long time. Any other guesses? Anybody else? Anybody else? Any other guesses? So 10 seconds is the amount of time that I'm getting in answers from multiple people, which is a correct answer. So once you're checking for pulse in the neck for 10 seconds, that is the right amount of time to check for pulse. In 10 seconds, if you do not get a pulse, that means this patient is in cardiac arrest. So I'll do a quick recap for everybody. So the patient was unresponsive. Step one, tap and shout on their shoulders. They did not respond. Then you immediately call 108, call the ambulance. Then you check for pulse in the neck for 10 seconds. No pulse. Then you have to start CPR because the patient is in a state of cardiac arrest. Now, this is the only right position to give CPR. As you can see, it's a picture. What are the things that you can find out about this picture which you think are correct? What is right about this picture? What are your observations? Simple observations in this picture. Anybody? This is an important question for the prize. It decides who will get the prize, right, Ankit? Yes. Posture, safe distance, left hand down and right hand on top. That is quite interchangeable. Chest press, posture, hands. Wonderful. I'm getting a lot of answers, but I will explain to you how medically it is correct. Medically, it is correct that as you can see in the position, the shoulders, elbows, and wrists are all in the straight line. Definitely, position is a way to describe it. The correct way to mention it would be right. Shoulders, elbows, wrist, they're all in the straight line. Straight line to what? Straight line to the patient's heart. So, and also, as you can see, the patient is lying down on the floor. The patient is made to lie down on the floor. It is not on a bed or a cushion or anything. And patient should be in a good posture. Wonderful. Hands on the breastbone. Okay, great answer. And also, what you should see here is that the patient and the resuscitator are at 90 degrees to each other. You're not sitting near the head of the patient, nor you're sitting near the leg of the patient. It's almost like 90 degrees to the patient. This is the only correct position to give CPR. Suppose, let's say, this lady who is giving CPR now, she's giving CPR to a 45, 50-year-old guy. If the patient is a 10-year-old child or a 3-month-old child, obviously you cannot use the same position and the same force, right? So at that time, you will use a different position and a different force. As you can see in these three pictures, the first one is adult, where we interlock our hands, like I'm showing here. The second one, if the patient is a small child, suppose 7 years, 8 years, 10 years child, you can use on the center of the chest with one palm. Or if the patient is a small child or an infant, which is 1 month, 2 months old, then you can use two fingers on the center of the chest as well. Although the depth is mentioned down here, 2 inches, 2 inches, 1.5 inches. In the emergency situation, it's very difficult to note all of this. You should push hard on the chest as fast as possible. The rate I will tell you now. Now, once you start the chest compressions, you have to do 30 such chest compressions followed by 2 breaths. Obviously, in a country like India or in any emergency situation outside the hospital, you cannot give breaths because the patient may have oral secretions like saliva, there can be blood, or you may not know the patient, you're worried about infection. So many things are there. In such cases, you don't need to do 30 compressions and 2 breaths. You can continue only with 30, 30, 30 compressions. So, these things that you keep hearing round again and again and again, this 30 compressions and 2 breaths is referred to as one cycle of CPR. So I repeat, the word CPR that you keep hearing again and again and again, the word CPR means nothing but 30 compressions and 2 breaths. It is one cycle of CPR. So a quick revision. I'm sure everybody is listening and I cannot have everybody's chat in. Number one, patient was unconscious. What did we do? Tap and shout. No response. When there was no response on tap and shout, we checked for pulse. Where? In the neck. For how many seconds? 10 seconds. 10 seconds, there is no pulse. You have decided the patient is in cardiac arrest. So then you went ahead and you started CPR. When you started CPR, one cycle of CPR means 30 compressions and 2 breaths. And at a stretch, you have to do 5 cycles of CPR, right? This one cycle of CPR is 30 compressions and 2 breaths. At a stretch, you have to do 5 cycles of CPR, which should be okay, finished in 2 minutes. Now, I'll do a little bit of math. Usually in contact programs, I'll ask the people sitting there to do the math. This 5 cycles of CPR, which you have to finish in 2 minutes, one cycle has 30 compressions and 2 breaths, right? 5 cycles, it has 150 compressions and 10 breaths. Even if you're not giving breaths, it has 150 compressions. That has to be finished in how many minutes? Just 2 minutes. That is 120 seconds. So what happens here? You have to compress at least twice per second. You have to go at the speed of 2 times per second. Then you will be able to achieve the correct speed for CPR, right? It is called as good quality CPR. I'll just do a quick revision for everyone to understand again. So step number one, we shake and shout. There was no response. When there was no response, we immediately called 108 and we went ahead. What if pulse is active? I'm getting a question. If pulse is active, definitely there is no need to CPR. it will be just treated as an unconscious condition, wherein which it can be because of low BP, low sugar, and other things. It can be corrected, and the patient will not be very critical. If the pulse is active, definitely no need to do CPR. We are discussing the condition of cardiac arrest only, wherein which the pulse is not present and we are giving CPR. Good question. So, in an unresponsive patient, we tap and shout, call 108, check for pulse and breathing. If there is no pulse, we start CPR. This is the only correct position to start CPR, and we do it in 30:2, which is referred to as one cycle of CPR. 30:2 is referred to as one cycle of CPR. At a stretch, we do 5 cycles, that is 2 minutes. Great. Now that you have done 2 minutes of CPR on a cardiac arrest patient, you have to reassess in this position. Again, questions for everyone. What are the advantages of reassessing in this position? Why not stand far away and do something like this? Why to reassess in this position? What are the advantages of checking a patient's pulse in this position? Anybody? Why can't we just stand and reassess? The lady here who is checking for pulse, what is the advantage of checking for pulse in this position? Avoid further CPRs, check for active breathing, as answered by Vibha and Karthik and Shweta. That's a wonderful answer. Okay. You can also see for the chest movements in the breathing. Also, you can see whether you can feel the breath on your face as well. This is an ideal position to check after 2 minutes of CPR. That is 5 cycles. So after this 5 cycles of CPR, you are checking like this. This you would be checking for again for 10 seconds only. So now when you're checking for 10 seconds, there can be three possible situations. There can be three possible situations. You have already given 2 minutes of CPR, that is 5 cycles of CPR, and now you're checking the pulse for 10 seconds. Now you can have three possible situations. Situation number one, no pulse, no breathing. That means your 2 minutes of CPR has not yielded any efforts. That means no pulse, no breathing. At that time, you continue the CPR. Obviously, you continue it for 2 more minutes, which is 5 more cycles. This is situation one. Situation two is when you check for pulse, pulse will be present, but patient is not breathing. In such cases, you give only breathing to the patient, because in such a case, pulse is present and patient is not breathing. So you give only breathing to that patient. The advantage of tilting the neck like this and giving breaths is that the airway becomes straight. You should not give breath directly onto the patient. You should tilt the neck and give proper breaths. At least 10 to 12 times in a minute, you can give breath. This is situation number two. Situation number three is pulse is present, breathing also present. In such a case, you can put the patient in a position called as recovery position. That means if you turn the patient to one side, like it is shown in number 4 here, if you turn the patient will be turning to one side, breathing will become easier, circulation will become easier, and you have given CPR for 2 minutes on an unconscious patient. If they have saliva, blood, vomit in the neck, or anything of that sort, it can fall to the side. So the patient can be in a good condition after getting pulse and breathing back. Any doubts with CPR till now? Any doubts? Anybody in the chat box? Any doubts at all? While you people type out the doubts, I'll be doing the quick revision again. One cycle of CPR means 30 compressions and 2 breaths. At a stretch, you do 5 cycles. That 5 cycles, that 5 cycles should be completed in 2 minutes. Once you complete the 5 cycles, you will again reassess the patient like this for 10 seconds. When you reassess the patient, then what happens? If you have no pulse, no breathing, you give CPR again. If you have pulse present, breathing absent, you give rescue breathing. If you have pulse present, breathing also present, then you put them in recovery position. I'll take the questions now. Yeah, I've informed the last slide again. What is the position of the hands to keep on hand? The hand should be interlocked like this. The heel of the hand, what I'm showing here, the heel of the hand should be on the center of the chest. Center of the chest, not left, not right, center of the chest. If any pulse count can be checked. Yeah, if you have pulse, there is no need to do the CPR. Second time CPR will be of the same duration of 5 cycles. Yes, Ms. Sridevi, good question. Even the second time CPR will be of 5 cycles and it should be completed in 2 minutes. How to ensure the correct number of compressions are being administered? See, there is no 100% way to ensure. The easiest way is 1 second you have to compress twice. That way you are not wrong. one second, two compressions. That is the easiest way to know. How much pressure? As I explained to you, for adults, it's around 2 inches or 5 centimeters. But let's be practical. We cannot count 5 centimeters while giving CPR. So there is a line that says push hard and push fast. On the center of the chest, 1 second, two compression, as fast and as hard as possible. Maximum, you may injure a small rib or a rib fracture, but that will not be a major problem. Don't worry about it because the patient is already dying. So don't worry about all other side effects or other problems. So good questions. Great. So if you do all of these things correctly, you can save 1 or 2 out of 10 people. But if you don't do it, the person is anyways going to die. Now, I have a question. You started CPR, right? You started CPR on a cardiac arrest patient. When can you stop CPR? Common sense. When can you stop? Common sense question, common sense answer. When can you stop CPR? When you get the pulse, right, Mr. Ankit? When you get the pulse, you can stop CPR. Or when the ambulance comes. When the ambulance comes, definitely you can stop CPR. Or when the patient is getting proper breathing until they get their pulse. But there is one non-emotional situation you should know. You can stop CPR when you are tired. Okay, because somewhere, if you are outside the city, if you are 100 kilometers away and the ambulance is not coming in 2-3 hours, you are alone with the patient, you cannot give CPR for 2-3 hours. Why I am telling you this is, some people don't attempt CPR because they are worried. If I give CPR and the patient dies, I will have problems. I will have legal problems. No, you will not have legal problems. If you start CPR, you try your best, and still if the patient dies, you are not legally responsible. So if you're tired and you cannot continue pressing twice per second, you cannot give good depth, then you can stop. We can only try to save as many people as possible. We cannot save everyone. So like I mentioned, if you do all of these things correctly, in 10 people, 1 or 2 people, definitely you can save. But if you don't do anything, you cannot save anyone. But if you have this fancy device, the shock machine, what we call it, the automated external defibrillator, we can save more people, right? It can shock the heart. We can do more things with it. And the success rate, out of 10 people, you can save 7-8 people sometimes. It's that good. Now, when you use this shock machine on a patient, you give shock to the patient. What happens to the heart? Who will tell me? Questions again, chat box. What happens to the heart when you shock a patient in cardiac arrest? I'm not talking about other conditions. There are multiple other conditions where we shock the patient in the hospital. But in cardiac arrest, when you shock the patient of cardiac arrest, what happens to the heart? Heart gets active, says Mr. Karthik. Anybody else? Small electric pulse to restart the heart. Okay, clears the flow. Blood is pumped. Okay, all wonderful answers. But like I mentioned to you in the beginning of the class, that I will clear some myths, right? There are some myths, there are some understandings. Heart may become active in condition and clearing the flow. So let me tell you that we get all of these information from social media, right? Or from movies where somebody is in cardiac arrest, and when we shock them, suddenly he'll get up, he'll run, he'll become an athlete, he'll beat other athletes, in even if he's never practiced in his life. So that's how they show it on movies. But it is not true. It is wrong. So in a general state, right, when you use this shock machine on the heart in cardiac arrest, it stops the heart. Okay, this might be a shock to all of you. How can that happen? The patient is already in cardiac arrest. How can it shock someone and stop their heart? Patient is already in cardiac arrest. I'll tell you how. This is the heart of a patient, right? When there is blood inside the heart and the heart is pumping like this, when the heart pumps like this, the blood gets pumped and you will get a pulse. You will see a pulse, right? You think, if the heart is pumping like this, when the heart goes into cardiac arrest, the heart stops. That is what you think, right? But in most cases, what happens is, a pumping heart, before it becomes into stable cardiac arrest like this, static position, it goes into some abnormal vibrations. Now see, this is a chamber of the heart contracting, and then heart does not stop, it starts vibrating. If the heart vibrates like this sideways, can the blood get pumped? No, it cannot get pumped. So we have medical terms for this: ventricular tachycardia, ventricular fibrillation, multiple other situations where the patient is unresponsive. You're checking for a pulse, there is no pulse. The heart can be like this, or it can be abnormally vibrating. So what this AED does, It identifies whether the heart is in a stable cardiac arrest or it is vibrating. So this identifies the vibrating heart, and when you press the shock button, the abnormally vibrating heart stops. It stops. So the immediate step after giving this shock is to give CPR. Okay. So the best way to restart a heart if if the heart is in cardiac arrest like this. If the heart is vibrating, you can't restart a heart. That's why in 10 cardiac arrests, if you give only CPR, you may be able to start one or two hearts. If you have this cardiac arrest defibrillator machine, it will identify a vibrating heart, it will shock it will stop it, and immediately you can start CPR. So all around the world, these defibrillators come in all shapes and sizes. Okay. In this shapes and sizes, it will work only in 4 steps. However, the shape and size of the defibrillator looks, it works only in 4 steps. I'll tell you the 4 steps. Step one is turn on the AED. You switch it on, switch it on. Step two is you attach the pads. I've shown in this picture how the pads are attached. Can you see on the pads itself, there is a small depiction of where the pad is supposed to be attached. The black color depiction. So even if you have never used this AED before, you will know where to attach those pads. This is step two. Step three, as shown here, it will analyze the rhythm. So basically, what is it analyzing? It is analyzing whether the heart is stable like this or heart is vibrating. So if the heart is stable like this, step four, it will tell you to resume CPR. Or if the heart is vibrating like this, it will tell you in step four to give a shock and then to resume CPR. Understood? So I'll just repeat the steps. Step one is turn on, switch on the AED. Step two is attach the pads like I've shown it in the picture. Step three, it will analyze if the heart is in a cardiac arrest stable or vibrating. Step four, it will advise you to shock. What is the immediate step after shock? The immediate step after shock is to resume CPR as it is shown in this picture. So if you're resuming CPR now, immediately, what is one cycle of CPR again? 30 compressions, 2 breaths. At a stretch, how many cycles will you do? 5 cycles. So all of this, the AED machine is going to count for you. So the moment you shock, you resume CPR, it will count 1, 2, 3, 4. 30 compressions done. Give 2 breaths, it will tell you. 5 cycles of CPR completed. Check pulse for 10 seconds. Everything it will tell you. So even if you have never attended a CPR class before, with an AED machine, you can have a running commentary guide. So that is why, and also it can put a vibrating heart into stop. This AED, the shock machine, you know what it's called? It's called automated external defibrillator. So heart is fibrillating. It defibrillates the heart and stops it. That is what it does. It does not restart anyone's heart like they show in the movies. It's very wrong. It rarely happens that the heart restarts. So immediately after the shock, you have to give CPR. And finally, when the patient comes to the hospital, this is how a hospital team will look like, right? Where we are giving CPR, one person is on ventilator, one person is giving medications, another person is recording the whole events, someone is, being the team leader and taking care of everything. So the success rate improves even further. So any doubts with CPR and AED, please put it in the chat box. Anybody, any doubts at all? What makes the heart to go into abnormal vibrations post cardiac arrest? Wonderful. There are at least 10 separate reasons why a patient can have cardiac arrest. 10 separate reasons. But more than 80% of the reason, 80% of the cause is heart attack. We spoke about blockage in the heart causing a heart attack. If heart attack is not treated, heart attack patient's heart is beating like this. Before it becomes completely stopped and the patient dies, in a good percentage of times, it vibrates for some time and then it stops. Heart attack is one of the major reasons of cardiac arrest. Other reasons are excessive blood loss, poisoning, and high potassium, low temperature, acidosis, acid in the body. Like that, multiple conditions are there. Any of these things can cause a cardiac arrest. But in cardiac arrest, the heart can either be like this or it can be like this. But in cardiac arrest, however the heart is, you will not get a pulse. What makes the heart go into abnormal? Yeah, I answered that. What creates a blockage? There are a lot of things that create a blockages in the heart. It can be high cholesterol, drinking habits, a lot of smoking, and patients who are having a sedentary lifestyle, are not active with their lifestyle, and familial history of heart problems, father, mother, grandfather, everybody died of a heart problem, then definitely there is a chance. How costly this AED machine in India? The basic AED machine is available around 1.5 to 2 lakhs, but I will show it to you in this picture. This yellow is the AED machine. The plug that is attached to it, the pads, that is a one-time use pad. So for one patient, you have to use that pad only once. That costs you around 8 to 10,000. The AED machine, it's 1.5 to 2 lakhs. If you buy once, you can keep it forever and use it. If you go to the airport, even if it's an international airport or not an international airport, every airport has this AED machine. Next time, please take a look. How to get to know heart pumping or not, breathe abnormal. See, you cannot get to know. This AED is designed for people who are non-medical people to use it. If the heart is like this, it will advise you not to shock. If the heart is vibrating, it will tell you shock and give CPR. How to get to know if the heart is pumping or not? You can get to know by checking pulse. If the heart is correctly pumping, you'll get the pulse. If the heart is not pumping, you'll not get the pulse. Blockage due to fat can happen. 112, 1 lakh, 1.25 lakh to 1.5 lakh, somebody's answered, which is exactly what I mentioned. Around 1.5 to 2 lakhs, you can get the machine for. Nowadays, after Corona, many people are dying irrespective of due to heart attack. What are the reason? Why do small? Okay, so Corona is just a life event that happened to us, and Corona, as such, makes our blood easy to clot. Imagine our blood is like water, right? It is not supposed to clot. But due to COVID, Corona, what happened is blood became more thicker during an active episode of COVID. When the blood, which is like water, became like thick like petrol or diesel, there is an easy possibility to clot. So that is clotability became easier. That is one. Some people blame it on the vaccine as well. Vaccine is nothing but heat killed virus. If you could have died because of COVID, you would have died because of vaccine. It's as simple as that. But let us be frank. We all know since the last 5 years, there are more IT jobs, there are more desk jobs. People leave 8 a.m. in 8 a.m. from the house and come back at 10 p.m. in the night. And whenever they are stressed in an AC room, they go out to the balconies and they smoke. They have tens and 15s amount number of coffees and teas per day. Don't eat healthy food. All of this is equally contributing, and all of these working class is in our age group, this 25 to 40 year age group compared to 60-65 year age group. We are not breathing the same air, we are not having the same amount of tension. Everything is increased now. So all of these factors does play a role. And small children less than 10 years, 5 years, they were dying before also. Okay, I've been practicing this since the last 10-15 years. I used to see small children die of cardiac arrest because of a undiagnosed heart problem. Some children will have, to make it simple for you, hole in the heart or some problems in the heart. So children at that age group used to die before also. But now with social media, everything becomes an exaggerated news. The rate of people dying is still almost the same. The age group has shifted. From 60, we have come to 20, 30, 40. So what are all the reasons for heart attack and cardiac arrest? Just like that I mentioned, Mr. Tarun, it can be high cholesterol, smoking, alcohol, sedentary lifestyle, not exercising, not taking care of your heart by doing some moderate physical activity, not going for health checkups, ignoring symptoms like chest pain, arm pain, sweating, thinking that it's gastritis. All of this can cause heart attack. If untreated, it can cause cardiac arrest. Wonderful. So now that is the dedicated time for that topic. I hope everybody is quite clear with cardiac arrest, how to restart a heart, how to use AED machines. Now we'll go on to the lesser dangerous conditions like first aid. Most of you may never most of you may never encounter a patient of cardiac arrest, but definitely some of you will encounter a patient of first aid. So when there is no pulse, can we understand that it's cardiac arrest? Yes, Ms. Sridevi, no pulse equals cardiac arrest, immediate CPR, immediate CPR. Yes, correct. Now, I'll go into first aid now. First aid is something that all of you will see on a day-to-day basis. It includes fractures, snake bites, choking, burns, and other things. This definitely you should know how to deal with it, because please guide on seizure, Mr. Karan. I'm coming into those topics. We are going into first aid where it will include all those conditions. What is the difference between heart attack and cardiac arrest? Mr. Kumar, I informed in the beginning. If you have a blockage in the heart, you experience chest pain, sweating, heart is still beating. Heart is still beating. You still have a pulse. That is heart attack. But when the heart stops beating, when the pulse disappears, it is cardiac arrest. How much buffer time range is there for generally a patient who can be? This is a wonderful question. Okay, when somebody has a blockage in the heart and they have heart attack, how much time do we have before they progress into cardiac arrest? Sadly, in the medical field, it is not 2 plus 2 equals 4. For one person, for a very tough and physically fit person like a farmer, army person, athlete, who are all physically very fit, for them they have silent heart attacks, they will not even get to know. For people who are obese, for people who are not taking care of their health, and cholesterol is more, for them the time may be less. But in general situations, you do have a few hours. You do have a few hours. There are always extreme situations, right? It's not like, for example, I'll take an example for a car company. Every Mahindra XUV looks the same, has the same interiors, colors will be different, right? Patients' heart attacks are not like that. The two people of the same age group having a heart attack, their blockage percentage will be different. Their area where the block is there is different. Their body surface will be different. Some of them will have more higher risk factors because one guy will be smoking, one guy will be not. So we cannot do a 2 plus 2 equals 4. But in most cases, you do have enough time to come to the hospitals and get treatment. Sometimes people are eating, doing something, they can't breathe, they struggle more to breathe. So breathing difficulties, I'm coming to all the situations. I'll discuss that. Okay. So I think we'll move forward from cardiac arrest, go to first aid situations. Can we know manually when the heart is vibrating? You cannot know because it's inside. As me and you are talking, do you know, do you feel your heart is beating? You can't feel, because heartbeat is something, unless you run 1 kilometer, you keep your hand on the chest, when it's palpitating, you can feel. In normal conditions, you cannot feel if your heart is abnormally vibrating or even beating. So in cardiac arrest also, you cannot know. Even if you do know, if you don't have an AED, you can't do anything. So just stick to CPR when you don't have an AED, and do AED when you have AED. That's the best thing to do. So we are moving on with first aid now. First aid, we are dealing with fractures. This is something that is commonly encountered by people in work-life situations and even outside situations. So in fractures, everybody know you have to do some tie. You can tie it with a wooden plank or a notebook or a scale based on the situation. But what one important point I want to make is, you can observe in these pictures, the fracture, suppose it is in the middle of the leg, the fracture splint, it is running from one joint above to one joint below. That means the fracture is in the middle of their leg here. We have stabilized even the knee joint and the ankle joint. On the next picture here, where the fracture is in the middle of the hand, the fracture stabilization is extending to the wrist as well as the elbow. Only when you do that, the pain of the fracture gets distributed. Otherwise, the pain is still on the fracture side. How you can remember is with the mnemonic price, that is, protect the injury, rest the injury, apply ice packs. Whenever there is a fracture or a suspected fracture, please do not massage the area to reduce the swelling. Please do not put hot water or hot packs. If you have to put ice packs, and comfortably support and give a comfortable support, and finally you shift the patient to the hospital and elevate that. Suppose I have a fracture on the wrist here, don't leave it hanging down, elevate it and keep it on the shoulder. If no other person nearby, what to do during CPR? Mr. Dheeraj Gupta, I'll tell you a question. People die. Okay? People die. You, Mr. Ankit, everybody in this room, everybody in this conference, we die. We can save the ones that we can. We cannot save everyone. If we did that, everybody would live 150 years. But there are most chances that if somebody is there around, they can help try to save their lives. Otherwise, we have to accept fate. We are not gods. We are human beings and we are doctors. So it's a sad situation. If nobody is there nearby, then the patient will die. Moving on from fracture to the next most important and highly, I don't know what to say. People all have an opinion about this condition, which is a snake bite. So I'm sure the chat box is going to get very busy now when it comes to snake bite. In Bangalore, especially because we are extending our apartments onto lakes and we are encroaching the forests and we are doing, you know, places for people to stay around everywhere. So snake bites have become more common now. I don't know if it's the same where you stay, but snake bite is a very important thing in India and you should know how to deal with it. Now, I will open the chat box for two separate categories. What you should do in snake bite. Can people type out what you should do in snake bite? What you should do when you have a patient of snake bite? Anyone? Yes, we're getting some answers. Somebody says lift the leg, not to run, stop the blood flow. Okay. Provide assurance is good. Keep calm. Take the patient to doctor and take the photo of the snake. Immobilize the part. Wonderful. Great. It is usually the case. It is usually the case that people have opinions when it comes to a snake bite. See, now I'll explain it to you with an example, right? This is my hand. Okay. This is my hand. If I have a snake bite here, right? If I have a snake bite on my hand, you would want to try to tie here. That is your immediate response, what you want to do. See, our human body is not a one pipe system. I repeat, our human body is not a one pipe system. There are millions of arteries and nerves and veins in our body. If I have a snake bite here, if you try to tie my hand here, you would think you're blocking the flow. Maybe if you tie it enough, there is no blood flow. You're doing it right, probably. But what about the blood circulation on this part of the hand? The blood circulation on this part of the hand also stops. Or I want to live another 30, 40 years. I cannot live those years by holding the tie on my hand, right? I eventually have to go to the doctor. I eventually have to take some anti snake venom. And when you remove it, the poison rushes faster also. There are a lot of side effects, there are a lot of problems. People believe a lot of things. I will clear it out to you, and I'm not telling you my opinion. This is proven medical facts, right? So when there is a snake bite here, you cannot tie it tight enough. If you tie it tight enough to prevent all the blood flow going into this area, you may risk this part of the hand dying because of no blood flow. And within a few minutes, 30, 45 minutes, 1 hour, this part of the hand dies. In most cases, you can't identify the snake. If you are like doing some farming work, if you are standing in the grass area, the snake bites and it goes away. If you can't identify the snake, you tie the hand, this part of the hand dies. Later, if it's a non-venomous snake and I have to cut my hand, it's not a very good situation, right? So you can't tie it tight enough to prevent blood flow. Even if you do that, you're risking the hand. Number two, this blood sucking. So many people have told that suck out the blood. The blood that goes from the heart goes away from the body, and then the blood from the veins come back into the heart. So if I get bitten here, and if you are sucking blood, it is the blood that is coming from the heart to my hand. You cannot ulta negatively suck the blood that is bitten by poison. It's impossible, because our veins have valves. You have valves in your water tanks, in wherever areas you use. Those valves will not allow you to suck the blood negatively. It is not possible. Don't do it. But still in India, people do it because there is a success rate. There is a success rate attached to it. Which is the most common poisonous snake you know in India? Anybody? Most commonest poisonous snake in India? Cobra, wonderful. Cobra is one of the most commonest poisonous snakes that you know in India. Easy to identify. It has a hood, and at the back, it has a spectacle. Now, in a remote area, if a cobra bites someone, and they have a mark on the hand because of cobra bite, right? And they're bleeding also from that area. But for some reason, this patient does not want to go to the hospital. Let's say the patient is 90 years old. They're thinking, I have lived my life, snake bit me, it's okay if I die, I am happy with my life, and they don't go to the hospital. But their loved ones, the 90-year-old patient's loved ones, they want to save them, they don't want them to die. So they tie here, they blood suck here. Finally the 90-year-old survives. Why do you think the 90-year-old survived? It is not because of tying or blood sucking. It is because even a venomous snake like cobra, when it bites, most of the times it just dry bites you. Dry bite meaning the snake is not in a mood to mess with you. It will just scratch you off and leave. You will have a scratch mark, there will be a bleeding, but the snake has not latched onto you and given poison. So dry bite is an actual medical concept. You can Google dry bite by cobra. Good amount of cobra bites are dry bites, but your understanding is there was a cobra, it is a poisonous snake, it bit me, I have a mark, there is bleeding, I should be poisoned. No, even cobras, vipers, they all give dry bites. And I saw in some question that some chat box question saying that you have to identify a snake. See, 5%, 10%, Russell's viper, cobra, good answers, right? So there are only 4 poisonous snakes in India. There is another myth that people think they should do is they kill the snake. Have you all seen that? Yes, they kill the snake, they put it in a plastic bag and they get it, so that we identify the snake and it is easier for us to give antivenom. I'll tell you one more fact. There are 4 poisonous snakes in India, right? Cobra, crate, Russell's viper, and saw-scaled viper. 4 poisonous snakes in India. Indian government has made it easy for us. If a patient is bitten by a snake, a poisonous snake, all of black mamba is not so much in India, Mr. Raghavendra. In India, 98% of snake bites are from cobra, crate, Russell's viper, and saw-scaled viper. This is most common in India. In India, the anti-snake venom, the snake injection, whatever you call it, the anti-snake venom, the same injection has the anti-snake venom of all these 4 combined. So as a doctor, if I feel you are bitten by a poisonous snake, I don't have to identify the snake. Even if I identify the snake, I have only one injection with me, which has combined all these four snakes antivenom. So that is why it is not worthy enough to kill the snake or take the risk to do that. If you come to the hospital, we have some tests. We'll do the tests and we can know how to identify and treat it. So I hope I've cleared all the myths related to snake bite. So what can you actually do is somebody answered it correctly. You can make them calm. You can restrict them, from moving around. You can immobilize them, because if you walk around, if you run around, the blood flows faster and poison flows faster. Agreed. Yes, Mr. Samukan. Thank you. Great. So anti-snake venom, all four snakes combined in one. Whatever I have told you, you can Google back, go back and see, and you can educate yourself. Great. Choking in adults, not so common. We have windpipe and we have food pipe. What we should eat, what we eat, it is supposed to go into our food pipe. But by mistake, it goes into our windpipe. The patient feels like choking. This is universal choking sign. So in windpipe, that foreign body is stuck. If you don't remove it, the oxygen will get blocked and the patient will die. So you have to stand in behind of the patient and you have to push from behind as shown in the image. One thing you have to make sure, when you're pushing like this, it should be backwards and upwards. I repeat, it should be backwards and upwards. If you do it straight or if you do it down, it is of no use. There is a high chance, when you're trying this, the patient can become unconscious. If the patient becomes unconscious, you're all masters of knowing what to do now. If the patient is unconscious, tap and shout, check for pulse, start CPR. But what you should not do is you should never try to put the finger and try to take it out, because it can go further inside, then you will not be able to revive the patient. By CPR alone, because of force, the foreign body can come out. You should never try to put the finger inside. This choking is very common in kids, not so common in adults. So when the kid is having a choking, it is shown in the image. First, you have to take the child upside down like this and give 5 back taps. Then you flip the child around and you give 5 finger pressures. Now, where did we see this 2 finger pressures on the chest? Where did we see it? Anyone? Where did we see it? Wonderful. We saw it during CPR. Correct. Good answer, Dr. Miss Gargi. Yeah. So that's the correct answer. We saw this during CPR. So I have to keep doing it. Why I have put this is, you should not do something that they show in the movies. They hold the child like this and start slapping ulta. So you should not do something like that. That doesn't work. They'll put the foreign body somewhere up and you won't be able to revive it. So this is the correct method to do it. You should tap 5 times on the back and flip the child around and press 5 times on the back, like in infant CPR. Wonderful answers, everyone. I'm glad everybody's listening. So blood clot in heart is heart attack. Blood clot in brain is stroke. There is no concept of brain stroke. There is nothing called as brain stroke. There is nothing called as heart stroke. Okay. Blood clot in heart is heart attack. Blood clot in brain is stroke. There is no such concept of heart stroke. Okay. So how do you identify a stroke victim? It is by the mnemonic B fast. B is they will lose balance. They will lose their eye visibility. They will have facial drooping. As it's shown in the image, if your face droops to one side, like this facial drooping, then when you try to speak, it will be a slurred speech. So facial drooping, slurred speech, and arm weakness, hands or leg weakness. So if any of these things are there, I repeat, it should not be everything. If any one of those things are there, that can cause a stroke. That is an indication of a stroke. Then time is important. You have to get the patient quickly to the hospital so we can reverse the stroke. So there are multiple windows wherein which we can reverse the stroke. It can be 3 hours, 4.5 hours, 6 hours, based on the scans will define. But still, there are a lot of stroke patients in India who are staying with paralysis. Their hands are like this or legs are like that. They can't speak. Why? Because some people can have this block in the brain in the middle of their sleep. By the time they get up, the stroke is very much advanced. You can't treat it. Or all of these stroke patients can be sugar patients as well. If they have this balance issues, speech issues, weakness issues, they will think it is low sugar and they will have sugar water, sleep and wake up. But this time it is not corrected. This time it is not a sugar issue. It can be a stroke issue. So always rush to a hospital when you have these symptoms. Strokes can be reversed, definitely can be treated in hospital within a good time. Unlike cardiac arrest, stroke does not kill, but it makes you permanently paralyzed. It is difficulty for the patient, difficulty for the family members. it is very difficult to live the life after that, being in such a situation. Then seizures. Similar to snake bites, seizures or fits. Somebody asked me the question in the beginning how to deal with seizures. Similar to snake bite, seizures or fits also, there is a lot of myth surrounding it. What do people do commonly during fit? I'm sure it's a famous answer. What do people do? They give a metal object in the hand, right? They give a metal object, correct? Iron or metal object in the hand. See, I'm holding a watch now, which is of metal or iron. So when I'm holding it, when I'm talking to you, I have no extra power to get any energy out of this metal object. When I'm having a fits, I will not get that property at all. But still, people do it because of a success rate that is associated with it. Why? I will tell you the medical reason for it. Fits or seizures, 97 to 98% of the times, they are self limiting. Self limiting meaning in 2 to 3 minutes, they stop by themselves. If you actually have a fits patient at home, you will know before they get a fit, they will get a pre fit aura. They'll have a spinning sensation of the head. They know that they are going to get some fit, so they'll lie down, they'll have a fit, they'll get up and go. It is not life threatening, right? If somebody has a fit, it will stop in 2 to 3 minutes in 98% situations. So that 2 to 3 minutes is the time required for you to see a fits patient, get anxious, run, get an iron object, metal object, give it to their hand. By then it will stop. You will always believe more and more it's because of the metal object, but that is not true, right? It will stop either ways. Recently we had a case where a young mother, the child was having a fit. She gave an iron. It poked the eye. Child survived. Fits did not do anything to the child, but it poked the eye. The child lost the eye. It is not worthy enough. Please do not give metal objects. But what you can do during a fits is put the patient in recovery position. Again, a question. Where did we see this recovery position? Where did we see it? The chat box is open. We saw this recovery position somewhere during CPR. Wonderful. After CPR, in a certain situation, the last phase of CPR, Chetan, wonderful. The last phase of CPR where pulse is present, breathing is also present. So when the pulse is present, breathing is also present, we put them in recovery position. It is similar to our seizure patient now. So this seizure patient is having a pulse, they're having a breathing, but because of this seizure or tongue bite, they're having bleeding in the mouth, they're having excessive saliva in the mouth, so that can get stuck in the throat. So you put them in a recovery position like this, you can prevent them from going into cardiac arrest. Wonderful answers, thank you, that's great. Now, first aid of bleeding. Again, bleeding from the nose is very common in cold conditions. You have these small arteries and veins, you check pulse. In the nose, they are much more smaller. So if you just blow your nose, if you try to clean your nose, if there is crusting in cold conditions, it can cause a lot of bleeding. Okay. So at that time, everybody wants to hold and put it back. That is wrong. You have to bend forward. You have to press and bend forward. The bleeding time of our body is around 3 to 5 minutes. So if you have a nose bleed, you have to compress and you have to wait 3 to 5 minutes. You should not check every 10 seconds whether it stopped bleeding. Then it will not stop bleeding. You compress, breathe through your mouth and compress for 3 to 5 minutes. In the same way, if you have a bleeding from somewhere else in the body, with a clean cloth like it is shown in the picture, you can just compress on the area with a clean cloth and come to the hospital. Very important. Last slide, burns. Burns is something quite common in hotels and sometimes at home. We have young kids, you're given them a hot milk or hot tea, they spill it on themselves. So burns, if it is first degree or second degree, no need to do much. In the home remedy only you can do. After a few days, it'll be all right. What you should never do, you should never try to prick that burn blisters. If you prick that burn blisters, it will expose you to infections. And also, to look at, it will look very dangerous and it will cause permanent scarring. So you should never do that. So what you can do is wash it with a clean cloth, clean water, and then cover it with a clean cloth. Mr. Shravan has asked me a question about dog bite. Dog bite in India. No, Mr. Somikan, I do not recommend using toothpaste on burns area. Although if it is first degree burns and the skin is intact, you won't need to do anything. Then you can use probably aloe vera, toothpaste, and all those things. But if it's a third degree, fourth degree burns, if you use a toothpaste on that area, it will get infected. I mean, for the time being, it will give you some sort of pain relief, but in the long run, it will get infected. And to answer Mr. Shravan's question, immediate action for dog bite, it depends upon the area that it is bitten. If it's an easily washable area, please wash the area with clean water for 15 to 20 minutes. Again, there is a lot of myths, and there is a lot of myths surrounding dog bites. Some people think it is a pet dog bite and the dog is vaccinated, so it can bite me. I don't have to worry. No, that is wrong. I'll tell you something. The vaccination that you are giving your dogs, your pet dogs, it is not 100% foolproof. Okay. It can be either adulterated or your dog has not developed immunity properly. And rabies has a 10-day latency period. Your dog may have come in contact with something. See, just don't take a chance. In India, the protocol is simple. Be it a pet dog, vaccinated dog, stray dog, you have to take a vaccine if it is a minor scratch or a lick. If the dog bite has shown bleeding along with the vaccine, when there is bleeding along with the vaccine, you have to take immunoglobulin also. Whenever the doctor advises this, please don't say no. Immunoglobulin is once in a lifetime thing. If you have a dog bite, bat bite, rat bite, cat bite, scratch, any of these things, and there is a bleeding, take immunoglobulin. It is once in a lifetime thing. After that, any other time, 2 years later, 3 years later, you keep getting these dog bites. At that time, you can take only vaccines. Using water for burn area, first degree, second degree recommended, third degree, fourth degree not recommended. What if burns we wash with water? Won't it increase the bubbles? See, bubbles are not dangerous. Bubbles are just skin's response to a burnt area. If the bubbles are pricked, then you open the bubbles into infection. That is a correct thing. Is big private all? Yeah, not just big private hospitals. Most hospitals which have multi-specialty effect, they all have anti-snake venom. Just don't go to small clinics or small hospitals. Any government hospital, any decent 50, 100 bedded corporate hospitals can have it. Can we use ice for first degree burns? Definitely. Please, can use. First and second degree, do your home remedies. How to identify what degree burn it is? Easy. You put the same thing in Google because I don't want to go in detail with it. How to identify what degree burn it is? Put it in Google, Miss Shweta. It will show you. First degree is only superficial skin. Second degree, second layer of skin. Third degree is dermis, epidermis, hypodermis, multiple layers of skin. Fourth degree exposing muscles, tendons, and other things. You put it in Google, you will have a nice pictorial representation of it. Any other questions? I like the questions I'm getting. Not just this, CPR and other questions, whatever you have doubts, please put it across. What if you have high BP during seizure attack? No need to do anything. You will have a high BP during seizure attack. Deal the emergency first. Okay. I'll give you an example. I'm having heart attack and chest pain, and I'm having hair loss. Where will I go first? Should I go for hair loss, doctor? Should I deal with heart attack? It's as simple as that. So you're having a seizure. It's a dangerous thing. Treat the seizure first. BP will reduce. If not, take them to the hospital. High BP can be easily handled in the hospital. First aid during heart attack, please. See, heart attack first aid, I was always counseling to give aspirin. This is my personal opinion. I'll tell you my personal opinion. If you have an aspirin tablet at home, if you're having chest pain, sweating, and all of that, taking an aspirin will reduce your heart attack symptoms, will give you relief most of the time. Most of the times. Then once I noticed that I've done, like I said, I've done thousands of these programs. Once what I happened, somebody, they were having heart attack symptoms. They took a tablet, they never came to the hospital because they felt better. That is very dangerous. That is why I do not advocate it. But if you are sensible, if you are coming to the hospital, having an aspirin tablet will give you some time. Monkey bite vaccination is required 100%. Dog bite, monkey bite, bat bite, all of which can cause rabies. You have to give vaccination and everything. Thank you for this amazing session. Wonderful. Great. Thanks, Mr. Gurumurthy, for joining. Signs of chest pain, heart attack, first aid for chest pain. There is no first aid for chest pain as such, because chest pain can be because of multiple other reasons. Mr. Pooja will do the consultation part later. We'll stick to the session related questions. So there is no first aid for chest pain as such. The idea is to go to the hospital as fast as possible and you can do the immediate required things. Is aspirin available in general medical? Yes, 100% it is available. So thank you for listening to me. Help us to help you. So I'll also be telling you about the Sparsh Kutumba card for people staying in Bangalore. As you can see in this card down, Sparsh Hospital is present in Yeshwanpur, Infantry Node, RR Nagar, Yelahanka, Hennur, and here. So all of these things that are mentioned in the Kutumba card, you can avail these discounts. If you can, get in touch with our marketing team through our hospital number, they will give this card to you. And also one more thing is, always take the chance to help someone and try to help them. And I saw some people giving me questions, right? So I'm quite active on my mail. So you can please go ahead and drop your questions on the mail for me. I've put off my mail here. I'll definitely get back to you. And I'm sure like we have 100 plus participants here. There are 100 plus questions. Everything related to this class, I've tried to address it. But do come back. on my mail so that I can address your personal questions personally, because I don't want to be talking about your personal questions in a public platform. So definitely I'll be addressing it through my mail.
Yeah, this is Karan. Thank you, Dr. Suhas. It was a wonderful session.
Thank
Uh,
you.
no, because CPR is something which is very much confusion thing, especially in India. I'm from Hyderabad, by the way.
Wonderful.
So,
So the famous reel of somebody dying on a badminton court with a red shirt was from Hyderabad. Yeah.
yeah, yeah, yeah.
Yeah, that has encouraged people to know more and more about CPR. Social media is good, definitely.
Now, I'll tell you, I have done a perfusionist course
Okay, okay.
long back.
Right, right.
Uh, but then, the clarity you gave in this short time was wonderful.
Thank you so much. Thank you.
So one quick thing from my side, I have already put that question that in
Right.
my family there's a low BP issue goes on with
Yeah,
everybody.
yeah,
So
yeah.
let's say suddenly if somebody is down with very low BP, I usually what I do is I raise their legs. But
Yeah.
my brother suddenly one day he had, maybe I can put it in the email. That should be
Okay.
good, I guess.
Yeah, yeah.
One common question for everybody like us is
Mhm.
if we want to have a basic training on emergency, just to
Right.
be helpful for our near and dear and in the society, what
Okay.
are some basic courses we can do uh, online, or some institutions are there which can help us?
Right, definitely. So what we do in Bangalore is I'm at Spurs Sarjapur Hospital in Bangalore. So we do visit our hospital from
Mhm.
our hospital to apartment associations, IT companies, schools, factories, and we do give them 1 or 2 days training as well. Because all of you would be in different streams. Some
Mhm.
of you might be IT engineers, software, pilots, railways. So it's very difficult for you to take time out from your regular schedule to actually have a training in this. But we do have a 1 or 2 day programs where we train the public. This PPT is also a
Mhm.
part of it, wherein which we address some common emergencies and we take some mannequins, some protocols, some things along with us, and we do a visual, actual demo as well. So apart from this, whatever other emergencies you have faced in your life, you can ask questions. So we'll demonstrate also how to deal with them. So that I think Yashoda does in Hyderabad, Yashoda High Tech City and Somajiguda, they do it. I think Dr. Saujanya, who's the head of Yashoda, they do it. So you can
Okay.
reach out to your nearest hospital; they'll definitely be able to help you, and it will also be done for free of cost. Then you can know things much better. So when I mentioned this help us to help you, it means that it means you learn things, you do things outside the hospital in a good way, so we can help the patient in a better way. If you do things based on social media or unscientific things, it will hurt the patient, it will harm the patient, and
100%.
our work also becomes much more difficult, and the recovery for the patient also becomes much more longer. So that is what help us to help you means. So definitely from this class you have had gained some knowledge. If you start practicing it, if you reach out to the nearest big corporate hospital, they'll be definitely willing to help you regarding this.
No, very true. I think maybe I'm eating others time, but then in my family, my
Yeah,
father had a high BP and then followed
yeah,
by a seizure attack.
right, right,
And
right,
before I reached there, my sister-in-law, she started doing CPR. Then
right,
I stopped. I was having doubt. I checked BP. It was already 211. If
right, right.
somebody does CPR on top of that,
Yeah,
what will be the
that can be
consequence.
dangerous. That can be. So what happens is, like I mentioned, 1 plus 1 is never two in medical field. The situation that you
Yes.
described now, it could have happened due to a few causes. A few causes that can be,
Right.
high salt content in the body, high sodium, or pre-existing BP condition, or stress during the multiple things. So to identify
Yes.
and treat it is a more complex thing. But the ideal first aid should be known by everyone.
No,
That
no.
is
The
what
basic thing what you said is check
exactly,
the pulse first, and that was very
exactly,
crucial. I
before
think
giving
that's only we
CPR.
should.
Yes,
Yes,
100%.
that was very
100%.
crucial. Yeah.
100%. Thank you
Thank
so
you.
much. Thank you
Thanks
so
a
much,
lot.
Mr. Karan. That was really
Thanks.
nice. Yeah, thank you.
So thank you all for being engaged participants. May we keep learning, growing, and serving others every day. Thank you so much, everyone.